host, Tracy Wolfman. On today's show, we have another very special guest. He is Bill Handerhan, a government program sales manager with Horizon Blue Cross and Blue Shield of New Jersey. Thank you for being on the show today.
Thank you for having me.
Bill has over 20 years experience in the insurance industry, spending the last 10 years specializing in the Medicare market. And today we're going to talk about what you do for the state of New Jersey, Bill. So why don't you just tell us a little bit about what your team at Horizon Blue Cross and Blue Shield of New Jersey does?
Sure. So I have a team of 6 employed reps that go out to across the state, helping people with all different types of aspects with their Medicare coverage. From educating them when they're newly entering Medicare at 65. We also do seminars throughout the open enrollment, which is in the fall.
Now, let me just ask you a little bit about those seminars. Do you advertise those seminars? Like, how would people find out about those seminars?
We do. Typically what we'll do is we'll work with a senior building or we'll work with a senior community and we'll advertise within that community. Or we will set up something offsite at a hotel or something like that and advertise it through our Facebook page and through mailings.
Oh, very good. Yeah. Because people, they're aging. And they're trying to navigate how they're going to age and how they're going to support themselves. Right. And then you have this whole big system of your insurance. And I think the managed Medicare is new to some people because they have never had to navigate it maybe for a parent or a spouse.
Right.
So when you do these seminars, like typically, what do they inform them of at the seminar?
So what we'll do is we'll talk first about the basics. So typically what we see is people either coming off an employer plan where they've had coverage through their job for a considerable amount of time, and they have to understand how that changes when they move off of that employer plan into a Medicare plan. There are a lot of different changes that happen in that transition. And so all of a sudden, I've been doing one thing for 30 years, and now all of a sudden I have to learn about how to do this new type of coverage moving into my Medicare years. So what we typically do is we start off with the basics. And then from there, as a group, and the great thing about having the staff that I do is then what we can do is also offer some individualized attention where we would go out to somebody's home. We could meet them in a diner or a coffee shop, whatever's convenient to them, and then go over more specifics that
like
pertain
on a one-to-one basis.
On a one-to-one basis, exactly.
I mean, I'm sure that's a huge undertaking for 6 employees that you have on your team.
Yeah.
For all the counties in New Jersey. I mean, I bet they work long, hard days.
It is a lot, but it's very rewarding because at Horizon, what we feel is that we're not just out to enroll people into a plan. We like to bring them through the process, make sure that they understand everything about what's going on with their plan, and I think that tends to lend itself to a much better experience as you move into those years.
I would agree with you. I mean, education and what they should expect is the best ingredient to success at the end.
Right, exactly.
So another part we're going to talk about here for our viewers at home that hopefully will get a good education today, the different parts of Medicare.
Right.
So we have different parts, and you can explain, and then hopefully we'll recap on that.
Okay, good. So, and that's one of the things, a lot of people just think that there's 2 parts of Medicare. There's Part A coverage and there's Part B. And that was what's called original Medicare, and that came into effect in 1965. And Part A is your hospital coverage, and Part B is really everything done outside of the hospital. Doctor, lab, all of that, those services. But there's 2 other parts to Medicare, which is Part C and Part D, as in dog. And Part C is actually Medicare Advantage plans, and that's one aspect, and that's part of the whole process that we talk about. And D was introduced in 2006, and that offered seniors prescription coverage through the Medicare system.
Right.
So that's the newest part, is Part D.
So they have hospital coverage. Then everything outside of the hospital, that would include like physical therapy, occupational therapy, things like that. So that's that. Going back to the Part A, the hospital coverage.
Right.
So they would be covered for 80%?
It doesn't work that way with Part A. Part
Okay.
A has a fairly large upfront deductible, and this would be if you had no other coverage at all except for your Part A offered through the government. In 2019, it's a $1,360 upfront deductible, which carries you for 60 days in the hospital.
Okay.
But and so that's how that works. Part B is more of the 80-20 relationship, where the government, Medicare, will pay 80% of the claim, and the member is responsible for 20% of the claim.
20%.
Yeah. So it's a
So
little bit
they would be
simpler.
billed separately by wherever they were.
Correct.
Okay.
Right.
So that's A and B.
A and B.
C,
Original Medicare. C.
Original Medicare. So
Right.
I think C and D are the ones that our viewers probably need a clearer understanding of.
Right. So C was added later on in the 90s. It's gone through several different changes, but Part C is typically when you hear about Medicare Advantage plans. Part C was designed to basically take Part A and Part B. At the time, there was, before Part D, it took those two benefits and then put them into one card that you would purchase through an insurance company. You wouldn't go through
interesting.
Medicare for the coverage anymore. You wouldn't have your claims paid by Medicare anymore. You'd have it paid by the company that you're with, somebody like Horizon, say.
Correct.
Then when Part D came along, Medicare Advantage plans incorporated that benefit as well and took A, B, and D and put them onto one insurance card. So this is most
That-
akin to something that like through your employer, where you're using a network of doctors, you pay a copay, you go to the pharmacy, you use one card for everything. And so it's a little different.
So do you think that that's working better for people, or has it been more complicated?
So in New Jersey, that's a great question, because in New Jersey always skewed toward what are called the Medicare supplements, and we'll probably talk about that in a little later. But basically, people would have a plan of coverage that would take over after Medicare paid. But what we're seeing now is more and more people are looking at Medicare Advantage plans. One,
Yes.
because of cost. Two, people are healthier now, and they're more health conscious, and we see that they don't necessarily need to have a plan like a Medicare supplement necessarily. And I think also people are realizing, because New Jersey is an interesting state because we're sandwiched in between New York and
Right.
Philadelphia.
Right.
So a lot of people have that notion that you have to go to New York for the best care, or I have to go into Philadelphia for the best care. And I think if people who really do their homework, we can see that the outcomes and the care that you can receive within New Jersey is sometimes better than the outcomes that you're seeing in some of these larger city hospitals. And so people don't necessarily need to have all the freedom to go anywhere they want to go necessarily outside of New
I
Jersey.
couldn't agree. Being a nurse myself,
Mhm.
I understand that whole component, but people, it's a mindset that until they experience the great care that we do have here, I mean, a lot of these doctors from these major hospitals in the city are opening up practices right here in
Right.
our own community.
Exactly.
So they have the same training as they had in the city.
Mhm.
They just have relocated, and they're just as good on this side of the state line as they
Right.
were on that side of the state line. So it's interesting, and I think it's an education piece
It is.
that people will transition. I think it's still a little behind the times right now because
little bit.
everyone always thought. But we didn't have the resources here in the state of New Jersey. I mean,
Right.
when you think about these major places that are right in our backyard now.
Yeah. So it really is a lot different, and that's why we see more and more people considering going into Medicare Advantage, because a lot of times it's more budget friendly, but at the same time they realize that they can get the care that they need closer to home. And typically people who are sick don't want to travel into the city anyway, so when they initially get into the coverage, they're healthy and they think, oh, I can go into New York for coverage, but when
Right.
you're not feeling well, the
When you're
last thing
not-
you want to do is go into the city and travel.
And it's costly, it's
Right.
draining on
Yes.
you. I mean, I've had a few people that have done that, and yes, I
Yeah.
know
Most people
Does
end
it-
up wanting to stay close to home.
they do.
Yeah.
So let's talk a little bit about, and just to go back one step, you said the state of New Jersey. We want people to keep that in mind who retire and are those snowbirds, and maybe we'll talk about that later.
Right.
But what is the difference between Medicare Supplement and Medicare Advantage plan?
Right. So we touched on that a little bit, but basically the difference is with a Medicare Supplement plan, it does exactly what it's saying it does. Medicare, the government, pays the claim first, and the supplement plan then pays what's left over.
Okay.
So sometimes you'll hear them called Medigap plans or
Yes.
secondary plans. It's all the same thing.
Okay.
Right? And it just pays after Medicare pays. Medicare Advantage is different in that you are now, the insurance company that you enroll with is basically taking over for Medicare. You're still in the Medicare system. You still have to pay your Part B premium to the
Right.
government every month. There's no change in that. But then you have one card in your wallet that combines all those benefits, and you use a network of doctors and hospitals. And again, it works more similarly to employer coverage. But there's all different variations of Medicare Advantage plans, and they typically vary by county. So your county of residence is the choices with Medicare Advantage that you have. So whatever choices are
Okay.
available in your county, that's what you can enroll in. Doesn't mean you have to stay in your county for care.
Right.
Just means those are the choices that you have to pick from. So it's a little different than the standardized supplement plans.
Okay, and they probably have the ability to choose within the county. So if they're,
Correct.
you
So
know,
there's
and
many offerings.
most of our counties are very large, so there's
Right. So
you know,
you'll
the
see
lines between them.
Right. So you'll see a set of options for you, and you'll say, okay, I like this option. This works for me. It includes my prescription benefits, it includes my hospital doctor coverage. I like this company. Maybe it's Horizon. They say, oh, I've been with Horizon forever. I'm going to stick with Horizon.
Right.
And I need to be budget conscious. So a Medicare Advantage plan a lot of times will be for somebody who is on a budget or is mindful of their dollars, at least up front on a monthly basis. That might be the way for them to go.
right, and then they can have everything in one place, and they don't have a secondary with another company that
Right.
they're trying to navigate
and three
to.
cards too, because with the
That's right,
supplement you
3
have to have
cards.
your Medicare card, you have to have the supplementary card, and you also then have to purchase a separate standalone drug coverage card as well. So there's 3 cards. It's a little bit more.
I think, I mean,
Involved.
if anything out of this first conversation we have, and we're getting ready to take a break, the importance of people understanding that, because I think that is a big misunderstanding with people.
Big
and you
time.
just clarified it so well.
Oh, thank you.
So for our audience out there, I would like to say we're talking to Bill Handerhan here from Horizon Blue Cross Blue Shield of New Jersey. We spoke about what he does at Horizon. We spoke about the different options of Medicare, A, B, C, and D. And hopefully we have a clear understanding for our viewers, right?
Hopefully.
And if not, we can call him up and you can ask him all the questions
Of
you
course.
want.
Yep.
We now have a better understanding of Medicare Supplement and the Medicare Advantage plan, and really, to make it summarize, one-stop shopping
One-stop shopping.
under one card for our viewers to know that.
Card.
And I think that's a great understanding for all of our viewers now. And when we come back, we'll talk about what else you offer.
Great.
We're going to take a short break here on Welcome to Scan, but we will be right back after these brief messages. Thank you.
So, if you're over 65, like me,
and active and fairly healthy,
Being active and healthy alone will not protect you.
Remember, the immune system weakens with age.
And if you're over 65, ask your doctor about your vaccination options.
we want you to be healthy and active.
Welcome back to Welcome to Scan. We are here speaking with Bill Handerhan from Horizon Blue Cross Blue Shield of New Jersey. We found out some very great information thus far, and stay tuned to learn some more great things about our Medicare plans that we have. So Bill, question that always, the biggest thing that's a problem these days is the cost of prescription drugs, right? So does the government give prescription drug coverage when they sign up for Medicare?
The government does not give automatic drug coverage when you sign up for
Right,
Medicare.
we know that.
We do
so
know that.
Explain to us what we can do.
And it is a misconception. A lot of people think that once they sign up for, they say, oh, I'm turning 65. I need to sign up for A, B, and D with the government. No, that's not really how it works. A and B are the governmental insurance, and yes, you do have to sign up when you're turning 65 or you're leaving your job.
Right.
But when it comes to the prescription piece, and we talked a little bit about Medicare Advantage plans earlier, where that benefit might be incorporated into a Medicare Advantage plan, some people will buy it as a standalone benefit, and you actually have to go to an insurance company to purchase that benefit.
Oh, so they can't even purchase it from Horizon?
They can.
Oh, okay.
Yes, absolutely. And any insurance company that's offering it in the county that they reside, it could be Horizon or any of the other offerings that are available. But the person actually has to go out and shop for that benefit on their own or with some assistance, which is what my team does when it comes to Horizon, is to educate them on how Part D plans work, what is important to the person in terms of the medications that they require.
Correct.
All of the different rules that are in Part D, because while it does need to be purchased from a private insurance carrier, the government has instilled all the rules. So we follow a set of rules that are standard across every single company, and they vary greatly as compared to, say, an employer plan, which works differently. There's phases of coverage. There's something called the donut hole, which people say, what's the donut hole?
Right.
There's all these terms that people hear about that are in Part D coverage that need to be understood to make sure that they're getting the best plan.
So your team that goes out to educate them will explain this?
Yes.
And I think because it's such a common term, if you could just touch base on that donut hole.
Sure.
Because that is always a question that people don't understand.
Sure. So basically what the government does is every year they create 4 phases of Part D coverage, and it could be a deductible phase, there's an initial coverage phase, there's something called the coverage gap, which is commonly referred to as the donut hole, and then there's some catastrophic coverage as the 4th phase. We don't see a lot of people getting into that catastrophic coverage, but a lot of people do reach the donut hole because what happens is the government sets a dollar amount of your total drug cost, meaning what the person pays out of their pocket plus the balance that's paid by the insurance company, the total cost of the drug. And so every year that dollar amount changes. It's been going up every year, it hasn't been going down, so it's been getting better for people, but it's still, if you're taking a brand name medication or maybe a biologic medication for maybe rheumatoid arthritis, you see a lot of people will hit that donut hole. And at that point, the cost structure of what somebody pays out of their pocket changes. It changes from typically what was a flat copay in the initial coverage phase to a percentage amount. And there's a lot of different calculations that go on. People, it's difficult sometimes to understand because that doesn't exist in the employer world on that coverage, right? So when I'm turning 65 and I've been on my employer plan, and now all of a sudden I'm thinking, oh my gosh, I'm on 4 brand name medications, and what do they all cost? Am I going to hit the donut hole? That's again where we step in and kind of help.
It's interesting because I don't think people have realized previously brand name versus generic name when they come to prescriptions.
Right.
But the general public is getting educated very quickly on that because they know now what the costs are, where they never did before, so everyone demanded that they have a Aspirin. And the other ones are just as good sometimes.
Absolutely, and when it really comes to those brand names, it really matters on Part D because of that fixed dollars that everybody gets. Now, and those dollars, the total cost of the drug is hard to determine because it could vary from pharmacy to pharmacy. Walmart might be a little less than, so again, somebody does have to be a consumer more than when they needed before when they were on their employer coverage because it didn't really matter.
No, it was a free-for-all.
It was just you paid your copay and that was it.
That was it.
Right.
So that hopefully people will have a good understanding. Our viewers, I hope you understood that. But if not, you can certainly call or attend one of the seminars that they have to educate you on that. But we want to talk next because this is a big area. Everything we're talking about is a big area, but this is a big area.
Yeah.
What if they missed the Medicare deadline sign-up?
Okay.
And how does that work? Because I'm sure that's a question all of you in the audience would like to know.
Yes, and we do see this from time to time. It isn't too common, but it happens more frequently than we'd like to see. And basically, the government puts a window of time for a person to enroll into the original governmental Medicare benefits,
Okay.
Part A and Part B. Specifically Part B, because Part B does usually cost a premium to the individual. It's not
Yes.
free. Part A typically is at no cost, but there can be some changes with that too. But B, almost everyone pays a premium for that on a monthly basis. So a person will sign up for Part B typically when they turn 65, which was the norm, but as we see people working longer, now it's as they come off of employer coverage. They could be 67. Usually what we see is somebody has a spouse who's a couple years younger, and the older person will continue, who has the benefits possibly, will continue to work longer to get that person to Medicare age.
To keep
that
the
they don't-
benefits.
To keep the benefits.
Yeah.
So that we see that a lot. But what happens is the government puts a late enrollment penalty rule in for people to make sure that they sign up when they're supposed to. And that basically is like a stopgap to make sure that people don't only enroll when they get sick. Because some people will wait and say, I'm perfectly healthy, I don't need any coverage, I'm not going to enroll in Medicare, right? But then as soon as something happens, they say, oh, I better get in now. Well, the government says
Right.
you really can't do that. You're supposed to enroll when you're eligible to enroll. And there's two late enrollment penalties that exist with Medicare. One is for B, for your Part B coverage when you're
Okay.
first getting into Medicare. And for every 12 months that you do not enroll, the government
12
will
months.
add a 10%
Penalty.
lifetime penalty onto your premium when you eventually do enroll.
That is very good information
Yeah.
everyone should listen
Yeah,
to.
that's a big one.
10% premium.
For every 12 months that you don't enroll
For your
past
life.
you're eligible, and that's added once you finally get in, they'll add that back in, and you'll pay that for the rest of your life on top of the regular
So
premium.
even if a person signed up 1 year late,
Yeah.
now they're paying that penalty for the rest of their...
Right.
Okay,
It lasts
so
for
you
their
don't want to
lifetime.
miss that
You don't want to
Medicare.
miss that. And there's other
Don't miss it.
there's opportunities to enroll outside of your the specific time that you are eligible as an individual.
Okay.
There's other chances.
Right.
But there's some rules around those too. And again, those are things that we explain to people as well, how those all work. And then the second late enrollment penalty is on the drug coverage. You're not required to get drug coverage.
When you
Nobody's
start.
or at any times.
Okay.
Nobody's telling anybody that they have to get a drug plan, right? It's an individual decision. But
Right.
if you need a drug plan and you didn't enroll in a drug plan when you were first eligible to enroll in a drug plan, and say you waited, I don't take any medications, I'm not going to enroll,
Right.
but 5 years down the road you start needing medications, at that point the government has a 1% monthly late enrollment penalty that accrues in the background. It's 1% of the average national premium, and call it 36 cents.
Right.
But that's a monthly penalty. And say we've seen people that have waited 5-6 years and then have had a significant penalty added to their plan, and that's a lifetime penalty as well. And these are governmental penalties. These aren't insurance company penalties.
No, I understand. Because they want to have everyone enrolled
You
and
have to
track
get,
them.
You want to get the healthy people in that, and there are plans designed for healthy people that have very low premiums and will be creditable coverage to avoid the penalty. That's what we try to tell people is that, just get a basic plan, even if you don't take any medication, so you avoid that penalty down the road.
Right. Is there any follow-up on your team's part of if somebody is not enrolling and explaining to them these penalties, or you wait for them to contact you?
Well, we'll inform people of what the penalties are and what that might look like down the road. But usually what we'll do is if somebody's pretty adamant about waiting, we'll just let them come back to us and make that decision. It's just hard to reach back to people sometimes and see what they've done.
It is, because I'm sure there's so many people that
Yeah, and we don't know. Sometimes they might want to choose Horizon, or maybe they just end up going with another
A different
company,
carrier.
right? So you really leave it up to the person.
So we're going to talk about when is the Medicare annual election period?
Right. Okay. That's a big one, and that happens every year, and it's from October 15th through December 7th.
Okay.
And that is basically the time frame where every person who is already enrolled in a Medicare Advantage plan or a Part D plan can go and take a look to see if they want to make a change. The interesting thing, and I think what a lot of people don't realize, is that Medicare supplements do not have an open enrollment period. The open enrollment
Right.
period is specifically for Medicare Advantage
Listen, everyone.
and for standalone Part D plans. That is it.
Okay.
If you're healthy, you can get into a Medicare supplement plan at any time. You can move around between plans.
Right.
It's when somebody has health conditions that there's some rules around supplemental enrollments.
Okay.
So that's a different, and then that,
Kind
again,
of game.
and that's again where we come in, is we try to give people that information. But open enrollment, it's really called the annual election period. The AEP is from October 15th through December 7th, and then somebody would choose a plan that would start that in January 1st of the
Okay.
next calendar year.
All right, so 2 important dates, October 15th to December 7th, and we're just going to do a little recap here. Bill Handerhan here is from Horizon Blue Cross Blue Shield of New Jersey. We talked about the different plans A, B, C, and D.
Mhm.
Medigap
Or Medicare supplement,
or
right? Yeah,
Medicare
same
supplements,
thing.
yes. And don't miss signing up for your coverage when you're supposed to, because there is a penalty, and you don't want to get that penalty for our viewers. And the 10/15 to 12/7 is the annual election period, and they want to make sure they're in that time frame.
Right.
That is a lot of information. I hope for our viewers that you got an education out of this today, because I certainly did, and I had a good understanding of it before I sat with
Yeah.
you.
Yeah.
I want to thank my very special guest, Bill Handerhan from Horizon Blue Cross Blue Shield of New Jersey. If you have any ideas for future topics here at Scan TV, you can contact us. We are located in the lower level of Monmouth Mall. We have a website, scannewjersey.org, or call us. Thank you very much for joining us, and tune in again next month for a Welcome to Scan. Thank you so much, Bill. It's been
you.
a pleasure having you, and I
Pleasure.
think we've given our audience a great education today,
Good. Hope so.
and a well-needed one.
Yes.
Thank you, viewers.